The broadcast is now starting. All attendees are in listen-only mode.
Well, good afternoon. Welcome to June's educational webinar sponsored by All You Serve. Glad many of you have been able to come and participate. Seems like a very hot topic. And welcome again. My name is Marsha Diamond. I'm the new business development with All You Serve, and we're very, very happy to sponsor these kind of webinars. Today we have two great speakers, Joan Dozel and Megan, and we are going to get started with our program right now. So I'm going to turn it over to them and up. Okay. Oh, before we get started, backtrack. Megan, backtrack. Megan Hammes, I'm going to have you backtrack. Good. So before we get started, I wanted to say that if you're a tweeter, hashtag will be healthy in all you serve. Tweet out for this webinar. We've got some great prizes at the end for people that do that. So the hashtag is healthy in all you serve. Healthy in all you serve. Just here's our new catalog, our new stealth carts, our modifiable room service meal assembly, and all you serve is definitely a player to collaborate with you. Without further ado, I'm going to pass it over to Megan, leveraging social networks, environmental supports, and internal partners for low-cost, high-impact programming. Joan Dozel is with us today, Director of Food and Nutrition Services, University of Iowa Hospital and Clinics, and Megan Hammes, from Manager of University of Iowa Wellness University Human Resources, University of Iowa. So today, you're going to walk away learning how to create and sustain a healthy campus culture through the development and delivery of best-in-class health and wellness programs for faculty and staff. You're going to be able to create initiatives that sustain over time to create added value and satisfaction. And you will be able to utilize an integrated health management model for your hospital, organization, school, or community. One housekeeping tip, this webinar will be available on YouTube early next week, the PowerPoint slideshow, and the certificate of participation. Again, hashtag healthy in all you serve is the tweet symbol, and please tweet out during the broadcast. Okay, Joan and Megan, all yours.
Thank you, Marsha. I want to do a little introduction. I'm Joan Dozel from the University of Iowa Hospitals and Clinics Food and Nutrition Department. I'm the current director. Just a little bit of information is that we provide approximately 3 million meals a year to our patients, staff, students, and guests that are here in this facility. Due to the location of our facility, we have a very captive audience in our environment. There's really not any competition that's very close to as far as food venues are concerned. So when we talk today about some healthy initiatives, like many of you, we've introduced many of those in our retail venues, which are actually within our facilities. Examples that we have of these initiatives that we've implemented, and I'm sure many of you have initiated many of the same ones. We've worked with menu boards, we've worked with labeling, nutrition information through a nutrient analysis program. Menu modifications are probably the thing that people notice the most, with just reducing sodium in some of our products, in our recipes, and all the way to taking salt shakers off the tables, modifying a lot of our recipes to, or adding, I guess I would say, more low-fat recipes and options, as well as whole wheat options, just to name a few. But as far as providing choice and options, the captive audience is something that we have obviously a fair amount of retail venues within this facility. So we offer choices and options in all those all those venues, and they are anywhere from a food cart to a kiosk to a full-blown cafeteria, and so we take the opportunity in each one of those to kind of create awareness, provide choices and options, and kind of support change in eating behaviors. And along with those changes, we also provide education through marketing and health fairs, newsletters, and then our You Choose Nutrition program. This is a collaboration of the University of Iowa academic and hospital campuses, and it promotes to promote healthy eating. And Megan's going to provide you with a little more detail about this program later in the presentation, but it is certainly about collaboration, partnership, not only in the UI campus that she will talk about too, but also with our community. So with that, I'll let Megan share with you some information on that.
Great, thank you, Joan. So I'm actually going to take a step back from what Joan described at our University of Iowa hospitals and clinics and talk about the University of Iowa campus as a whole, which includes our hospitals and clinics. So we are a very large Big Ten academic research institution. You can see some of the stats on the slide. We are a state-funded institution as well. But some little known facts that you might not know about the University of Iowa, located in Iowa City, Iowa, is that we're home to the world-renowned Iowa Writers Workshop. We were the first public university to admit men and women on an equal basis in 1855, the first to grant a law degree to an African American in 1870, and the first state university to offer insurance to employees' domestic partners in 1993. So some facts that we're really proud of at the University of Iowa. Our campus is very large. As you can see, we have over 500 buildings on a fairly decentralized campus. So our healthcare setting is rather large, and then we have our main academic campus as well as some satellite locations. So we are fairly decentralized. My role in the University of Iowa is I'm the manager for the Live Well Faculty and Staff Health Promotion Program. And so our mission is to create and sustain a healthy campus culture by providing programs to our employees, of which we have over 17,000. And so my goal today is really to describe for you a number of programs and services that we offer, as well as some of the outcomes and results. One thing that we have on our campus is what we call an integrated health management model. And this slide is rather busy, but why I put this up here is for you in the audience to think about all of the areas that you have at your organization that really support individual health and well-being. Because in your work in food service, you are often called upon to provide healthy nutritional options and maybe partner with other entities at your institution, such as a wellness department. And so we feel like our model is extremely collaborative and integrated, and it just kind of highlights people that we really rely on to assist us in providing health and wellness programs. So all around the model, we have areas, our workers' compensation area, safety, environmental health, a lot of our healthcare services provided through our hospitals and clinics. And then we have our university HR kind of at the hub of that coordinating effort. So we have what we call an integrated health management advisory group with members from all of these areas across campus that really help us set initiatives and set programming for campus. And Joan mentioned the You Choose program, and that really is kind of one of our banner programs that was charged by our integrated health management advisory group. Said, you know, we really need to take a look at nutrition across campus. Our data for faculty, staff, and students isn't trending the way we want it to. We have a lot of unhealthy eating patterns that we've noticed. And so we were really tasked with the opportunity to create a campus-wide program that really helps people to change their nutrition behavior. So that's when Joan and myself really started working collaboratively about 5 years ago. So that's kind of a framework for how we decide on a lot of the programs that we offer across campus. So again, I just want to share with you over the course of the next 40 minutes or so a lot of the different programs and services that we offer, but please know it's in the context of things that you probably have the opportunity to get involved in within your organization, whether you have a well-established wellness program or just a budding one. Many of the things I'll talk about are very low cost, fairly easy to implement, low-hanging fruit, if you will. And my goal would be that at the end of this presentation, you can identify one strategy to implement to help instill a more healthful culture at your organization or enhance an already existing program or partnership that you already have. So on our campus, how an employee gets started with wellness programming with step one is to complete a personal health assessment, and this is often referred to as an HRA or health risk assessment. And this is where somebody completes a survey with all sorts of questions about their health and well-being. So questions about nutrition behaviors, physical activity, tobacco use, etc. Upon completing that survey, we offer individual health coaching to our faculty and staff. And then beyond that, because we have our medical healthcare center, we have a lot of campus resources and experts. And so our health coaches provided through our wellness program are able to refer people to programs that we already have in place, such as mindfulness-based stress reduction program, for example. So kind of going back to that integrated health model, we have structured our wellness program so that we are already utilizing resources that we have in our campus. And as people that work in a healthcare setting, you probably have a lot of units and departments that are really focused on wellness and well-being for the patient. So a lot of opportunity for collaboration and offering some of those programs to employees. So a little bit more about our health coach service. We do provide it for free. For us, this is not a vended solution. This is something that we have trained our own staff to be health coaches. Because we are so large and decentralized and our healthcare operation is 24/7 in nature, we will work with people out of multiple locations across campus via phone, Skype, or email. The picture shows one of our health coaches working with a nurse, and what we really love to do is we love to send our health coach staff out to the units to meet people where they're at so that we don't have to ask our staff to leave the unit to get some wellness services. Online is extremely important for us. Again, because we're very large and decentralized, it's important that we're also offering online programs for our employees. So aside from taking the online personal health assessment, which is a vended solution, we have some personal wellness modules on topic-specific areas like nutrition and weight management that we've also worked with a vendor to provide. And these are great because they are online, they're accessible 24/7 from work, from home, from remote locations. And so I mentioned a few programs that we have with the personal health assessment and online programs being a vended solution. We also have some homegrown programs, if you will. We have worked with our IT department to develop a platform whereby our employees can earn what we call Live Well points, and they accrue these points for reporting different healthy behaviors. And then once again, we've partnered with a lot of on-campus partners. So we have a safety store through our children's hospital. We have groups that provide massage on campus. We have a University of Iowa bookstore that has a lot of Iowa Hawkeye gear and paraphernalia. And so we've partnered with these on-campus entities so that as employees accrue Live Well points, they can spend those points to purchase different things from these internal partners. So just kind of a fun way to keep people engaged in health and wellness and keep it in front of them. The screenshot that you see is actually our employee portal, so it's where employees are already going to check their paycheck, to elect their annual benefits. So we were able to kind of get real estate at that portal that already exists and people are already going to participate in wellness programs. Our Family Services Office is a really unique area that focuses on work-life balance. So we know that a lot of our employees are challenged with child care coverage and issues, as well are caring for aging parents and relatives, and these can be big stressors on an individual when they come to work. So our Family Services area is able to provide people support in these areas, direct them to community resources to help out, and the group is also responsible for looking at flexible work arrangements where they make sense. Another key partnership in helping our employees out is our Employee Assistance Program. At the University of Iowa, this is an internal EAP, so we have our own counselors on staff. Again, those of you listening might be a variety. This may be a vended solution, but they're really a key partnership. And our wellness program, we try to do a great job of educating people what the Employee Assistance Program can and can't do. And so they do our traditional counseling for stress, anxiety issues, but I think what a lot of people don't know about EAPs is they often will help people who have sleep concerns, challenges with sleep, challenges with finances. So we really try to partner with our EAP to get our employees to that resource if they need it. And then a final partner that I want to highlight that your institution probably has as well is some sort of ergonomics expert or ergonomist that will go out and do a job task analysis. And it's very common for departments like this to be focused on injury and helping people come back and recover, or if there is an issue. But again, we really utilize our ergonomics program to look at things from a preventive standpoint. So if departments are going through remodeling or ordering new office equipment, or we have a new building coming online, we really like to take a proactive look at the workstation and design and fit the workstation to the employee to minimize injuries from ergonomics. So again, it's not a part of the wellness program, it's a key partner that we've identified. So now to talk about, again, what I consider kind of some low-hanging fruit in terms of wellness programming, talk about some grassroots efforts. These are really the ones that can be fairly low cost. So I mentioned internal partnerships. We're very fortunate here at the University of Iowa to have a lot of centers of excellence. It's not my intent to recreate the wheel, so where we have opportunities, reaching out to our campus experts and partners to see what types of programs, clinical trials perhaps, they have going on that we can really tie into to benefit the health of our population. Many of you are probably involved in social media. Hopefully you're tweeting healthy at all you serve throughout the presentation. But we have had a lot of success and more work to do, but a lot of success adding on to our communication plan, a social media component. We really started in 2013 with our efforts launching Twitter, Facebook, and Pinterest platforms. We used a large event, an annual health fair, to kind of launch and engage our vendors at the health fair in social media. My staff, quite honestly, we just didn't quite have the time to research how best to go about social media. So we were able to partner with a College of Nursing student program. So we had a group of students that worked with us over a semester, and they were in somewhat of a consulting role to us. I mean, these students were really up on social media trends and gave us a lot of good advice. What we also asked them to do as a part of their project was create an 18-month content calendar for us. So, so we were able to have content ready to push out from the Live Well program, and this is a program we spend about $100 a year on managing a content management platform. It's very, very easy to use. It gives us some metrics to track monthly. And so we're able to really learn what types of posts engage our users. We still have a ton of work to do in this area. It is by no means our only mechanism for communicating to our faculty and staff, but it's extremely low cost and it's a way for people to reach us very easily. This is just research that shows that the people that we have strong relationships with impact our behavior. So this is probably not new information for you, but we know that the people that we surround ourselves with, and a lot of times that's coworkers, right? We spend a lot of our lives at work, a lot of our lives with our close colleagues and coworkers. And so the health of the network around us really impacts our own health behaviors. And this is very well documented in the research, especially from a smoking and tobacco use perspective and obesity. So social networks no doubt influence our behavior. So individual health really does translate into the health of an organization. So one very common program, and again, many of your institutions probably, hopefully, if you have a wellness program, have some kind of a wellness ambassador or wellness champion network. These are grassroots advocates and champions for a healthy work culture. And at the University of Iowa, we have about 143 kind of spread out all around campus. These are the people that we communicate programs and events to first. We give them talking points to bring to their staff meetings, and we encourage them to invite the wellness staff to their department to do a whole host of different things. You know, maybe we bring a presentation, how to pack a healthy lunch. Maybe we send out student interns to lead people in stretches they can do at their desk, a whole host of things. But our Wellness Ambassador Network is a group that really helps us achieve high participation in programs. They help answer frequently asked questions, and they're a very credible resource kind of at the local or department level. Somebody might not know or care who I am, but if the message is coming from their wellness ambassador, it's often very powerful. So some keys to success for grassroots networks that we have learned over time are having an application or nomination process. Until we implemented this for our Wellness Ambassador Network, we weren't quite sure how our wellness ambassadors were delivering messages to their unit. So an application process really allows for a supervisor to sign off on the person applying. It allows us to ask them why they're interested in being a wellness ambassador. So that made a big difference for us. Providing wellness ambassadors with regular training opportunities. For us, this is just once a year. We have an in-person meeting one time a year, hour and a half. We tell them about upcoming programs and events, give them lunch, and then throughout the rest of the year, we communicate to them through email and in-campus mail, providing them with different materials. We ask them really specifically to do things. So if we're trying to get people to sign up for a holiday wellness program, we first go to our wellness ambassadors and encourage them to get a certain number of participants. And then finally, we share best practices and results with them. So recently, I had a wellness ambassador connect with me and tell me that their department started a salad club, and people just signed up to bring healthy ingredients to the workplace. It really didn't take a lot of effort, but it gained a lot of traction. People were very excited about that. And so we shared that with other wellness ambassadors on campus and said, hey, this is something really easy that your department can do to have some fun and make sure you're getting a healthy lunch. So environmental supports. Have a few programs to share with you here. And on our campus, actually it was 7 years ago, no, 6 years. Oh, when was the flood? 7 years ago. We had a large flood on our campus, and we actually had a lot of buildings that were destroyed. So our campus continues to rebuild after that. So from a built environment standpoint, we actually have a lot of opportunities to build with health and wellness in mind with some of our construction projects. I would say that's one good thing to come out of the flood, if you can say that. But we recognize that that's not common. You know, a lot of facilities are aging, and there's not necessarily a lot being planned that can be done about that. So what are things you can do to help improve the environment in which we spend so much of our time? So one program that we implemented, we're going on 3 years ago now, is something called a Wellness Grants Initiative. And this was something we did need to identify funding for. But it doesn't need to be a large amount of funding. It really can start small. And what the Wellness Grants Program allows for is departments to request funding to do something wellness related at the local level. So here on our campus, this very much mirrors staff appreciation grants. People have done all kinds of things with wellness grants. They've purchased sit-stand workstations that a number of employees are able to share. Departments have purchased exercise equipment that they can keep at the local level, and we send a staff member out to show them how to properly use equipment. Departments have brought in massage therapists to do free 10-minute chair massages. And so all of those things have been fairly low cost, but they have extremely high satisfaction. So again, this is something that really was not too challenging to implement. We have a committee that reviews the applications, and very rarely are applications denied. So that's a very fun program. And then we have the built environment. So how does an environment support health and well-being? I mentioned sit-stand workstations. We're seeing more installation of water bottle filler stations, so we really like to highlight those across campus. And then as I mentioned, anytime a new facility is coming online or being designed, are there lactation rooms to support nursing moms coming back to work? Do people have access to shower facilities in case they are doing an active commute to work, walking or biking potentially? Do they have a place to park their bike, et cetera? And on a lot of campuses and healthcare campuses, these things exist, but maybe they're not exactly known about. I'm sorry, the slides keep flipping. I think I have a bug in the slides. But another thing that is fairly easy to create from a wellness programming standpoint is let people know what different walking routes are around a facility. So we can't assume that everybody knows this information. So if there is an opportunity for an intern to go out and, you know, measure different routes, there's a 1 mile loop outside, there's a 1 mile loop inside, and kind of add to that year over year, that can really gain a lot of traction with people. Again, sometimes we make the assumption, well, so-and-so, you know, people have smartphones, people have Fitbits, they can figure out their routes themselves, but not everybody's comfortable and confident that they know a safe route, that they know exactly how long it will be. So I feel as a wellness program, that's a huge thing we can provide to people, is just make it easy for them. You know, what are walking routes they can do in a fairly short amount of time close to work. So what I have up now is a little bit about our campus nutrition program, You Choose. This was an awesome partnership with Joan and her dietetic staff, as well as our university dining service that provides food to our residence halls on our campus for students. And kind of the whole goal was to improve some of our nutrition behaviors across campus. We just weren't, data just wasn't showing us that we were making a lot of an impact. So our whole premise was we want to make this as easy as Subway. You know, I know when I go into Subway, I see the subs with a little check mark next to them, and that's what Jared ate to lose all of his weight. How can we create something that simple without Subway's marketing budget? and so that's really where we brought people from across our campus, people with dietetics backgrounds, people with marketing backgrounds, and we said, how can we label food to make the healthy options stand out? And we always came at it from a philosophy, as Joan mentioned, we will provide choice. You know, I can still go into our cafeteria and get a big old cheeseburger if I want it, but it's not going to be the thing that's the most visible, and it's not going to be highlighted with the You Choose emblem. And so So we've had a lot of discussion, and we came up with a criteria that you can see on your screen. Pretty straightforward, looking at saturated and trans fats, calories, low sodium, and then healthy beverages, and then items or entrees that meet this criteria. They get a little apple with an eye in it. Our website gives a little bit more information about the program, but this has been great in terms of directing people to healthy options. And like any program, we recognize we still have a lot of work to do. It's a work in progress, but ultimately our goal is to let people know that there are healthy options wherever they dine on our campus. So next I'm going to move into the outcomes and results. I've shared a lot about what we're doing here, but kind of the...
Megan, can I stop you for a minute? Megan, and maybe
Yes.
Jonah, you can answer this before we move further. Could you explain how the proximity, I mean, we're talking about university, I know you're going to go on to the outcomes and results and why bother doing this, but just to give you the dynamics of how come you two collaborated and the dynamics of space, what's going on there so that people get a visual to understand how they can, we talk about the community, we talk about the university, we talk about the healthcare system, but why did you bother collaborating with Joan?
Well, Joan is an expert in nutrition, and I'm not. So, no, that's a great question. Part of it, I think, Marcia, is that we have this integrated campus advisory group, and they looked to us, the wellness program, and said, what are you doing about nutrition? We're not having an impact. We're the largest employer in our community, Iowa City, with 17,000 faculty and staff. We have patients and visitors to our hospitals and clinics from all around the state of Iowa and beyond. And what are we doing about it? And so I know that for me and the Live Well program to try to tackle this huge issue on our own is not going to have a lot of traction. And we don't have a blockbuster, subway budget. So what we did was we said we need an advisory group on nutrition. And so Joan, being the director of food and nutrition service at the hospitals and clinics, was a key player, as was her counterpart for our residence halls or dormitories on campus where students are fed. We knew we couldn't just have a blanket nutrition program without some real dietetics expertise and analysis, what makes sense from a labeling and criteria standpoint. So we brought key players together and really planned for that. As for a space standpoint, it was important to consider, our campus is huge. We're extremely spread out. So again, it was important for us to be very planful and inclusive of where we're providing food to people on campus. And there are still areas that we have yet to cover. Do you have anything to add, Joan?
I think what I'm hearing is that you don't know where the school ends or where the healthcare ends, because the way your campus is, that both students end up in the hospital dining venues.
Yep.
And
that is right. So we have our hospitals and clinics is defined, by boundaries. It's a large building with multiple dining facilities, but we do, we have a medical school, we have a college of nursing. So in the hospitals and clinics, there are, not just patients and visitors and staff. We have students. Because there is good food there, we have people from buildings in close proximity coming into the hospital to eat because there aren't restaurants nearby. So yeah, we're very integrated that way. Now, on our academic side of campus, that is interesting. We're very interwoven with our community and downtown area, and there are some fabulous restaurants downtown. We are fortunate that a lot of them have taken an interest in providing healthy options, but we could consider them, competitors in a sense. A lot of people, go downtown to eat, but we have a lot of dining and satellite locations within buildings. So our College of Business has a dining facility in it. Our main library has a dining facility in it. So when people aren't able to leave over lunch, to head downtown, we want to make sure that the dining facilities at their building have healthy options identified.
Okay, thank you.
So no, that was a really, really great question. So I mentioned our personal health assessment survey. We have excellent participation in this. You may have gleaned off of one of the previous slides that we do have an incentive for our employees to take this survey. So you can earn up to $65 for participating in this 10-minute survey. That's part of the reason we have excellent participation. But as you can see, it's really grown over time. So employees trust our program year over year with their health information. The online programs and health coach service have high utilization in the thousands as well. So that's 73% participation for 2014. That represents over 12,000 individuals taking that health survey. So what do we do with that information then? I'll get to that in a second. One other piece of data that we collect is satisfaction on our programs and services. This is probably one of the easiest things for a wellness program to do right off the bat is collect participation and satisfaction. It's not very sophisticated, but it is information. And it's useful information that can help leverage more support for a wellness program. So if you're just starting, you got to do this. You got to collect stories, how people are making important changes to their lifestyle, and you have to have people saying that your programs and services are great and they trust you and they would do it again. So with the personal health assessment data, this just kind of highlights some 5-year trends for our participants campus-wide. So you can see healthy weight, haven't made a ton of progress there. So that continues to be a focus area for us. Good nutrition. 2011 is when we implemented You Choose on campus, and Joan and I love to take credit for that. We don't know, though, why people started to report a lot of improvements in nutrition. We think the stars aligned, and we certainly hope that the You Choose program had something to do with our improvements we've seen in good nutrition. And then physical activity, stress management, non-smoking status, and sleep are other things that our personal health assessment measures. So pretty positive campus trends. We really love to share this. Taking it a step further, if you probably are not familiar with Dee Eddington's work. He was formerly at the University of Michigan. And what Dee Eddington's really body of research focused on was putting individuals into low, moderate, and high risk based on their behaviors. So somebody who's in high risk, or that purple band, this is an individual that practices 4 or more unhealthy behaviors. So it's, somebody that is a smoker, perhaps they're overweight, they don't exercise, and they have poor nutrition habits. That's high risk. Low risk being 0 to 1 of those risk factors. And here at the University of Iowa, looking at our personal health assessment data, the graph on the left shows people that took their PHA in 2012 and 2014 and kind of how they migrated. And what we're happy to see, and we've demonstrated this year over year, is that we have more people flowing into that low risk category and less people in that moderate and high risk bucket. And so what the research tells us is that lower risk people cost an organization less. We are self-funded, like many of you probably are. We're directly responsible for the healthcare costs of our employees and dependents. So we say that cost follows the risk of an individual. So what we did on our campus, and again, being in human resources, have the ability to do this, is we looked at sick leave use for these different risk bands. So not healthcare dollars, sick leave use, and we found, and I don't think this is surprising, that our healthy, low-risk individuals utilize less sick leave. And there's a huge cost associated with this. And, many of you are in food service, and so you know what it does to your area when you have people out. They're home ill. It increases potential overtime costs. It creates a lot of stress and angst in the area when people have to cover and pick up shifts. So those are indirect costs. We don't quite know exactly how to put a dollar amount on that. We just know it has an impact on the workplace. But when we look at just the dollar amount that it costs us to have people out of the office unnecessarily, it's huge. And so year over year, if we can demonstrate that we have more and more people at low risk, so people that are adopting healthy habits, stopping unhealthy behaviors, we know that this produces a huge cost avoidance for us when we're keeping our healthy people healthy as they get older. So using some of this data, we really communicate to our university leadership that health and well-being programs make a big difference to the bottom line. So we're very proud that we've done some studies in our benefits office that have shown that participants in our wellness programs have lower adjusted annual claims cost of over $300 year over year than our non-participants. So producing data like this really allows us to continue to have some leadership support. This year is also the third year in a row that we're passing along a 0% health increase to our employees. So just some things that as we've been doing wellness programming on our campus for a longer period of time, we've been able to make some significant and meaningful progress campus-wide. So for those of you that are, still listening, and hopefully you're awake, that may have wellness programs already in place, and you're kind of like, yeah, we do this. What are next steps? So things that we're looking at, kind of future focus, are employee engagement. So how are we linking culture and engagement results to our health and well-being metrics? We're really getting better at, as an industry, of connecting the dots between employee engagement and employee health. So somebody who really, really likes their job tends to stay healthier, and people who are healthier tend to enjoy their work more. So kind of how can we marry the two? Talent management is a focus for us on our campus. A lot of, institutional knowledge, people that have been here for a long time, have a ton of knowledge about their field, their area of expertise, world-renowned researchers and cancer and all sorts of things. As these people, as these people exit the institution, what are we doing from a succession and planning standpoint and talent management, and how important it is to make sure that well-being is a focus of that. And then also, because we're the largest employer in our community and as healthcare institutions, a lot of you have major community initiatives that you're doing to integrate yourselves into the community. What are we doing to improve the health of our community? So from a dietetic standpoint, is there somebody who's serving as a resource to help consult the community on providing healthier options? Because the reality is we spend the rest of our time outside of our work in our community, so ensuring that our community is healthy as well. So those are kind of next targets for us to make sure that we're very well integrated with. And I guess that's the main information that Joan and I have to share with you today, and we would welcome the opportunity for any questions or comments from the audience.
Well, Megan, one question is, Joan, I know that before you and Megan collaborated, you started a program, and that was the Grassroots for You, and then it grew from there. So could you tell us a little bit about, because I know you did a webinar for us a while back, tell us a little bit about that and how it connected or interwoven into Megan's program.
Well, again, it's the program that we started was to just set something in place here at the hospital that could help serve as kind of a guidelines for people to either select or give them an option to make some type of healthy choice. We soon realized, though, that with the opportunity to be on the campus integrated program, that what we really wanted was not only here, but something that could go across campus, so no matter where the student might be here at the hospital practicing something, they may be taking classes in the academic end of the campus, and no matter where they would go, they would have some type of a program that they could identify with. We had obviously an established logo and so forth, so that it didn't matter where you were or what you were doing. It was that partnering as far as across campus with all of our customers and all of the entities that are there, which had a huge impact and very, very much we did spend quite a bit of time making sure to see, are people identifying with the apple, with the logo, to see if there was the awareness that was out there. So it's just that opportunity to expand what you, taking something from maybe a small, get something started, and then looking out to see who that might impact, or who could we collaborate with, or what we might do as far as reaching out and be partners.
And the other and if anyone has questions, please type it in. And one other I see somebody has a question. One other question is, in food service, obviously you had the collaboration of the university segment, which Megan is from Wellness, but you also had food service dining from your university director, and as well as you had, obviously, you, Joan, who collaborated. Did you offer different choices? You got social media. What other means did you communicate out that you were doing this initiative, and did it impact your revenue when you were doing it from a food service point of view?
Yeah. Well, this is Megan. I can kind of speak to the communication and marketing piece, and Joan would be able to speak to the revenue piece. So when we launched, we had a number of communication efforts. So our wellness program for faculty and staff, and there's also a student wellness program as well that was a part of this group. We did a lot of communicating through normal communication channels, different newsletters that we do. We developed a website. And then what our wellness staff were sure to do when we were out giving different presentations to departments, if they had questions about nutrition, or they said, it's really a challenge, there aren't healthy options on our campus, boom, we will pull up Joan's website and menus online that have all of the healthy options identified. So some of it was word of mouth, some of it was normal communication channels. We are still working on this. How do we help educate people about what the Apple logo means? Because we have thousands of new employees that start every year, thousands of new students that come onto campus every year. So it's not kind of a one and done deal. It's constantly letting people know that this is available. You have choices, featuring healthy items. So our group continues to meet, and I would say that's one of the main discussions we have is how are we letting our customers know about the healthy choices and keeping it fresh, and making sure there are not just one healthy option but many healthy options. So communication is a constant thing that we discuss and try to figure out ways to continue to communicate.
Yeah, and it's this is Joan. I was just going to comment on the revenue piece of it. From the hospital side of things, we actually started with trying to identify, but did identify some healthy options and choices for the customers that were here at the hospital. Went to the, actually took a small dining area that we had and made it a healthy cafeteria, because the feedback from our customers were that I don't want to have to try and wade through the entire cafeteria and figure out where I can pick up all these items. I'd like them all in one place. So we did that, but I will tell you that the revenue, people talk about it a lot, but the revenue, having it all in one place did not increase revenue. And so that was part of, going through a process that listening to our customers, doing what we thought our customers really wanted, but some loved it, but most did not participate and go through that healthy dining area, that all the items met all the guidelines that we had established. So we stepped back again and said, how can we make a bigger impact? And it all gets down to the same things we've been talking about throughout this entire presentation. It takes time. It takes a lot of time. We've been at this several years. It is about communication. It is about continuing to make it fresh, bring new ideas forward on how we can basically educate and make people aware of what might be a better choice, if it's through tiered pricing or whether it is adding, focusing on a certain category of like beverages, whatever it might be, and actually have made moved forward quite a lot with that, and has made it one of those things where not only in the hospital but again across campus, that it's widened that so that people can make those choices not just in one place but throughout a number of venues that are out there.
So I've got another, thank you. And one other question is, when you mention you choose, you list low sodium. Could you talk about what you define low sodium as?
Yeah.
I'll repeat that again. When you mention you choose, you list low sodium. Could you talk about what you define low sodium as?
So what we kind of put on the presentation today, that's one of our external marketing pieces. So yeah, it just says low sodium, right?
Yeah.
So that's been an internal discussion of our committee, and specifically kind of the dietitian analysis group. And so we have different categories. We have entrees and meals and side dishes that we've kind of defined each of those. And then there's a criteria for each. So I think the limits are 700 or under for an entree, and like 350 or under for a side. And does that sound right, John?
Close.
Okay,
Yeah.
it's close.
Yeah.
And so, so in some of our meetings, you know, the people doing the analysis have come back and said, okay, this meal does not meet, this is a healthy meal. It meets all of the criteria except sodium. We're 100 milligrams over. What should we do? And we have kind of left that open-ended to our dietetic staff to use good independent judgment. So if it really is a healthier option and a healthy meal, and we want people to choose it from a health perspective, and it's over what we've set as our internal limits by a little bit, we will still label that as you choose. We don't put that in our external advertising to our customer. We have the exact information if they want it, but we were kind of running into a challenge of having a specific number as a limit, so we just use a little bit of independent judgment. Similarly, we might have a pretty unhealthy item that meets all of the criteria. You know, I think licorice and Skittles meet the criteria. They're low fat, they're low sodium. And so are we going to label Skittles with you choose? No. So we kind of use independent judgment the other way too and say, you know what, we don't want to label that. That's not really a healthful choice. So that's a really good question. You were paying attention when you looked at that slide.
I think the customers that we serve, that you don't want to get into too much detail with them. I mean, they get confused when it's so many milligrams of sodium or whatever. So what Megan's saying basically is that we simplified that enough. All they want to know is this a good choice for me? Or if I have two options here, which one might be the better one?
Yeah.
So that has been much well received. And
if somebody does want the exact nutritional information, we have that, and we do have that online and available.
Yeah.
And one final question, I think. What was the impetus to get started with a program like this? What was it? Your bosses? Was it the community that wanted it? What made you decide that you should move forward in this capacity?
Yeah, that's a great question. Well, I think it goes back to having that integrated campus advisory group that is a high-level leadership group really setting the agenda for health and well-being on our campus. And that, because it is a high-level leadership group that looks at data, looks at healthcare trends, you know, really that group said, we need to look at nutrition. You know, it's a problem for us. And so what came out of that was a charge from two of our university vice presidents that said, you know, Megan in the wellness program, we're charging you in a campus initiative that focuses on nutrition. And so we didn't know at that time what a campus initiative focused on nutrition was going to look like, but we got together, and this is kind of what was born out of it. I think beyond that, you know, really what got people to care about this, it's our culture. You know, we have had a well-established wellness program for 10 plus years now, so we've worked a long time at building a culture of wellness. So recognize that not all companies may be yet to this level, but it's like, that's why I think identifying partners, identifying players, collaborators is important, because you usually don't start out with a big budget to do health and wellness, and you usually don't really start out with any staff to do it. And so I think that's where Joan and I feel like our collaboration has been so successful, is because each of our departments and programs have their strengths, and together we can do a lot. Individually, we can't.
Okay, so I have one other question. I think I can have time for, I have two more questions. I think we have time for them. One question was, someone says they have a similar program. They're considering a tiered program. Is this something you've considered a better, best, okay choice?
Oh, do you want to respond to that? Like tiered, like green, yellow, red, like better, better.
Yeah, or light green, medium green, and dark green, you know. Or
yes, we did consider it here, but we didn't go in that direction. I think those work out fairly well wherever they are. It's that easy identification again, whatever it is. If it's and I think visual is very important. I think most people just they see it and they want to, you know, it's something that helps them to select what's the best choice.
Yeah.
And the last question is, I heard you say you include all kinds of foods, so you are not deleting any kind of food such as a soda, fried food in your environment. You're just giving people various choices, so you have a halo healthy kind of effect for those, but you're not depriving people who want that comfort, quote-unquote, food. Is that correct?
Absolutely not. It's all about choice, and it's all about making a selection, and us just helping make people more aware of what we offer.
And I mean, there's some behind the scenes things that Joan's group has done that nobody knows or asks, like, you know, so there aren't big size, large size soda cups anymore. Those just magically disappeared. There's low, no fat sour cream used in recipes. Nobody knows that. It's kind of behind the scenes healthy changes, but there's always
Excellent. Well, if you have any other questions, just send them to me. We have no more time today, but I thank everyone for being on this month's webinar, and I want to thank Megan and Joan for their wonderful, first of all, for what they're doing for their community, secondly, for sharing and giving us ideas on how to get started. Again, tweet out. I'm going to give out some gift cards, so if you tweet out, if you don't know how to tweet, give me a call, but tweet out, you'll win a $20 gift card. Participate, and hope you enjoyed it, and please fill out our survey at the end so we can make these educational webinars better and better and keep getting information to you. Any questions, you'll be able to find this PowerPoint on the All You Serve webinar, and we have a whole new products to help with your healthy initiatives, such as displays and maybe allergen-safe equipment, all of these things to kind of help you continue to do best by your clients, your patients, your students, your employees. Thank you, and have a great Thursday. Thank you again.